Alrighty. Hello, everyone. My name is Matt Zamboni, and I'm currently a physical therapist here working at a clinic in Southern California. Today, we will be discussing a sports-related injury that is becoming more prevalent, especially in youth sports today, as the level of competitiveness and participation is increasing. The injury we will be going over is Little League elbow. Oops, I moved this. Just like I had mentioned, with participation and the level of competitiveness increasing among youth sports, more youth athletes are experiencing and being evaluated for sports-related injuries. Little League elbow is exactly what it sounds like. Little League baseball players are the most susceptible to this type of injury. This injury is most common for athletes between the ages 8 to 15 years old due to growth plates still developing into bones. Studies have shown that approximately 26 to 40% of adolescent throwers experience some type of elbow pain. Some contributing factors are playing high volume throwing positions, like being a pitcher, a catcher, or a shortstop, improper throwing mechanics, and not getting enough days rest. The etiology of this injury is it is an overuse injury associated with the medial side of the elbow. And if you look to the left, you can see the medial side of the elbow right around this area. Sorry. When throwing, a valgus force is produced during the early and late cocking phase. Majority of this force is placed on the medial epicondyle, producing injury patterns. Signs and symptoms of this injury are pain, especially when throwing, swelling, difficulty fully extending the arm, stiffness in the elbow, and in some cases, a bump can appear on the medial side of the elbow. So if you look to the left, I included a picture of a youth baseball player throwing a baseball. And just like the description to the right, a valgus force is produced, and majority of this force is produced on the medial epicondyle, so right in here. And this looks like this is an unnatural movement, so you can only imagine how much force and stress this part of the elbow is taking. Treatment of this injury. Rest. Rest is the go-to pretty much. If an athlete sustains this injury, they will be asked to stop throwing for about 4 to 6 weeks or reduce the level of throwing, duration, and amount of throws. Non-steroidal anti-inflammatory medication and ice may also help. Immobilization may be used if symptoms are severe. It is important that a strength and endurance program should be continued to maintain cardiovascular fitness and overall strength, as it could lead to imbalances, making them more susceptible to improper mechanics. And in very rare cases, if this injury is severe, the athlete may require surgery. So some preventative strategies for this injury is proper pitching mechanics / throwing mechanics, regulating pitch volume and pitch type. Pitch type is, like curveballs and stuff. So at 9 years old, they shouldn't be throwing curveballs. It should be just regular throws. Active rest, like playing another sport. So instead of playing baseball year round, like travel ball players, it is important to play other sports that don't involve throwing. So like including soccer, where they're still working out, maintaining their fitness, just not as much throwing. Fourth, physical conditioning year round is very important. Proper warm-ups are just as important. And what I believe is one of the biggest preventative strategies is educating coaches and parents about this injury. There's also no evidence showing braces and taping techniques help prevent this injury. So if we look to the left, we I have a picture of proper throwing mechanics, and proper throwing mechanics should be taught at a very young age when they first begin, like maybe 7, 8 years old, so that they don't build improper, or so that they don't learn improper throwing mechanics. So we have the wind up, the cocking phase, the acceleration, and the deceleration. And just below this, we have regulating uh, the amount of pitches a pitcher should throw. And this ranges all the way from 7 to 18 years old. We have the max amount of pitches they can throw, and just to the right of that, the required days rest um, for how many pitches they throw. So if they throw 21 to 35 pitches in that day, it is required that they have 1 day of rest. Lastly, here are my references, and that should be it. Thank you very much.